Good day, everyone, and welcome to Immigrants in Healthcare, a free professional development opportunity based on the upcoming report, Immigrants in Healthcare, Keeping Americans Healthy Through Care and Innovation. This webinar is hosted by the Public Education Institute at the Immigrant Learning Center in Malden, Massachusetts. We are joined today by participants from 35 states and the District of Columbia, and you will hear from 5 experts from around the country, brought together to discuss this crucial topic. I am Denzel Mohammed, the director of the Institute, and I'm assisted by the Institute's team of Crystal Yer and Cho Salma Win. The Immigrant Learning Center was founded 23 years ago by Diane Portnoy to give immigrants a voice in 3 ways. First, through free year-round English classes to any immigrant or refugee adult who walked through the door, serving nearly 9,000 to date. Then, since 2003, the center has been educating the public on the economic and social contributions of immigrants through its Public Education Institute, which hosts today's webinar. And finally, since 2012, through the Institute for Immigration Research, a joint venture of the ILC and George Mason University, which publishes national-level data on immigrant contributions. This is the latest webinar of the ILC Public Education Institute. We regularly do these webinars and online workshops for immigrant-serving professionals, faith communities, and for educators to get the data, research, and best practices directly to the field so you can be better equipped to do your important work. Now, during the economic downturn, healthcare was one industry that experienced sustained growth. With an aging population and more people insured than ever before, it is crucial that we look at this industry's staffing needs ever more closely. We are all affected by healthcare, from the moment we are born right throughout our lives. And most, if not all of us, have had a healthcare experience with a foreign-born doctor, nurse, aide, or pharmacist. In fact, immigrants are buttressing the healthcare industry more so today than ever before. And with predicted shortages in critical functions, as we'll soon hear, they will be even more indispensable to keeping America healthy. Today's webinar releases the main findings of an upcoming report to be released later this winter by our Institute for Immigration Research. It is the only report that compiles data and research across the spectrum of healthcare functions, from medical scientists to home health aides, in addition to offering the human perspective through interviews and profiles of immigrant healthcare workers and expert testimonials. It is hoped that the findings from this report and the perspectives, strategies, and models offered by the expert panel will assist those in direct service, advocacy, and policy organizations to further your missions and goals to better integrating immigrant healthcare professionals. Before we get into the findings, it's a good idea for us to look at the data and see what has changed with immigration in recent history. So here's a statistical overview of immigrants in the U.S., focusing a lot on education and labor. One important thing to note, contrary to the prevailing narrative, is that immigrants are only about 13% of the total population. This is not the highest it has ever been. It was almost 15% in 1910, a century ago, dropped to less than 5% in 1970. But what is happening is that immigrants are coming from different places today. And again, contrary to the prevailing narrative, more immigrants today are coming from Asia than they are from Mexico. How is this possible? Well, more immigrants from Mexico are returning to Mexico. It's about the same, actually, as those coming to the U.S. So there's it's ground to almost a net standstill of those coming and those leaving. And the fastest growing group in the U.S. currently is Asian. Where immigrants are settling is also changing. Gateway cities are opening up in the South and the Midwest, and so the fastest growing states for immigrants are actually Tennessee, South Carolina, Kentucky, Alabama, and Mississippi. Why are immigrants moving to these states? Well, because they want to work. Immigrants come with the intention to work. And if you look at this graph, you'll see that belly in the middle there, and the prime working age group of, let's say, 25 to 64. Immigrants come to the U.S. to work, to provide for their families, to create better lives for themselves, for their children and their grandchildren. And they do this by filling critical roles in many industries, from transportation to food, retail, building services, and of course, as we'll soon find out, healthcare. So again, whereas they make up about 13% of the population, they make up almost 17% of our labor force. This outsized role extends also to the high-skilled immigrants who come here on H1B visas, for instance. And the result of having these foreign-born high-skilled workers is a net benefit to Americans as well. More jobs are created in satellite and downstream companies and industries with every H1B visa that's granted. And this is happening across the board. And if you look at places like Texas and California, tens or hundreds of thousands of new jobs are created and will continue to be created via this system. And of course, the bottom line is that this isn't something America needs. Again, with its aging population, the status quo is currently unsustainable. 10,000 baby boomers are going on Social Security and Medicare every day between now and 2030. Today's youth are paying taxes to support a level of benefits for today's seniors that they have no realistic chance of receiving when they become old. So whereas in 1950 there were 16 workers for every person in retirement, in 2010 there were only 3. Looking forward, therefore, by 2030, nearly 1 in 5 U.S. workers will be foreign-born. And if you think of industries like healthcare, to be able to take care of the baby boomers, this is something that we critically need. Another myth about immigration is that immigrants don't have much education. And the fact of the matter is that today's immigrants are actually the smartest in U.S. history. More recent immigrants than ever before are coming with bachelor's or other advanced degrees. And even in areas where, like South Carolina, where immigration has peaked in terms of its fast growth, there's a concomitant increase in college degree attainment of immigrants in these areas. So with time, those who are already here are becoming more educated. Of course, more education means better jobs, means more money in taxes, and therefore net benefit to everyone in the community. And finally, we want to look at immigrant entrepreneurship. Again, that entrepreneurial spirit of coming to the U.S., of taking a massive risk, of leaving everything behind and starting life anew, engenders an entrepreneurial spirit in terms of becoming self-employed, starting your own business. So immigrants are twice as likely to start a business, whether it's something small like a mom-and-pop shop, a grocery store, a restaurant, the things you see on Main Street every day, or whether it's something driven by technology and innovation like Google and Yahoo and eBay, things that on a macro level give the U.S. a cutting edge and continue to do that. These are the things that give the U.S. an advantage, a competitive advantage. Our strength lies in our diversity, and we must not lose sight of something like that. And every time you see one of these immigrant-owned businesses, you should be reminded of that entrepreneurial spirit and drive and determination to make better lives for themselves. To access more data, especially very localized data on the foreign-born in your communities, I encourage you to get in touch with the Institute for Immigration Research at George Mason University for their Immigration Data on Demand online service. And to learn more about the Immigrant Learning Center's Public Education Institute, to learn that we do more than just webinars, we have research reports, and we will soon be hosting our 5th annual Immigrant Entrepreneur of the Year Awards, and so much more, please visit our website. Now I'm going to pass it on to Dr. Marcia Horn, who is the author of the report, Immigrants in Healthcare, Keeping Americans Healthy Through Care and Innovation. Dr. Horn was the director of the Public Education Institute here since its inception in 2003 until her retirement in 2014. She has published extensively about immigrant entrepreneurship, as well as organizational systems and adult basic education, given her more than 20 years' experience in adult learning and systems development. In 2011, Marcia was honored with the Community Champion Award from then Boston Mayor Thomas Menino and the Mayor's Office of New Bostonians, just one of many accolades she's received in her 40-plus year career. Marcia?
Thank you, Denzel, and hello, everyone. This is Marcia Horn, and today I'm going to talk to you about immigrants in healthcare, specifically immigrants in medicine and medical science, long-term care, and nursing. But before I begin, let me just tell you that I use the terms immigrant and foreign-born interchangeably. Foreign-born is how statistical data is collected, but I think we are all more familiar with the term immigrant. But I use them interchangeably, and they mean the same thing. So next, we're going to sort of look at the big picture of immigrants in healthcare. Now, as Denzel mentioned in his demographic overview, immigrants are about 13% of the overall U.S. population and 17% of the workforce. So when you look at the percentages of the foreign-born as healthcare workers, it's even more dramatic. 27% of physicians and surgeons are immigrants. 22% of nursing, psychiatric, and home health aides are immigrants. 15% of the registered nurses are immigrants. And it's a slightly lower percentages in the technologies and therapeutic areas, but still a significant area. Now, most of the physicians that are in that 27% are international medical school graduates. Now, these are folks that went to medical school in their own country, so we're reaping the benefit of that education, and they come to the United States to do their medical residencies. Now, the important thing about these international medical school graduates is the rate at which they go into internal medicine. Internal medicine, or primary care, is the backbone of the healthcare system, even more important under the Affordable Health Care Act. It is not a specialty that U.S. medical school graduates go into at a great rate. As you can see here, it's about 15%. And if anyone who has tried to get a primary care physician knows there is a big shortage. So that it is very important that we have these international medical school graduates that are doing their residencies in this area because they will be very important for the whole healthcare system. Immigrants also have a very strong presence in pediatrics and family medicine in comparison to their native-born counterparts. They have significant percentages in other areas, of course, but it is most dramatic in those first three, and especially in internal medicine. So the international medical school graduates, or IMGs as they're referred to, are a critical medical workforce. 75% of them stay to practice in the United States. 78% are in direct care, in other words, they care directly for patients. And moreover, many practice in rural and inner city settings where there's often some unmet needs. Many native-born physicians don't want to practice in these areas, and immigrants are addressing that need. If you look at this map, you'll see where the IMGs, the International Medical School graduates, are practicing. This map shows the top 20 states where most are about over 20% of the physician workforce. You look at California, Arizona, and Texas, they're all well over 20%. If you go over into the Midwest and upper Midwest, there's very significant percentages there, very dramatic percentages when you get over on the eastern seaboard. Massachusetts is about 23%, Connecticut at 28%, and New Jersey at almost 39%. New York has almost 38%. And as you go down the eastern seaboard, you can see significant presence, and down into Florida where it's slightly over 35%. Now, this doesn't mean that the international medical school graduates don't practice in the other states. These are the top states. Now, there are other groups of foreign-born physicians. There's those that were trained abroad and did their residencies abroad, so they come here as full-fledged physicians. They face many credentialing challenges because they are asked to repeat residencies. They have to take licensure exams. So many are unable to practice medicine in this country. And then you have a group that came to the United States as children and were educated and trained here, and we're going to meet one of these folks in just a minute. Like the IMGs, they bring the needed diversity and cultural understanding to the practice of medicine. Now, there's another area where the foreign-born have a significant presence. It often overlaps into being practicing physicians, but that's in medical science. And 42% of the medical researchers in the top 7 cancer research centers in the United States are, in fact, immigrants. And here is one of those folks. This is somebody who is both a practicing physician and a medical researcher, Nam Tran. Nam came to the United States at age 8 as a refugee from Vietnam. And he went through the Phoenix Public Schools, and there were pretty low expectations for the Vietnamese students in the school system. But Nam was fortunate that there were many teachers who took an interest in him, recognized his talent. They made sure that he got into the gifted and talented program, and so they really supported him throughout school. So that made it possible for him to go to Northwestern University, where he put himself through repairing motorcycles. And then he went on to obtain a PhD in neuroscience at the University of Southern California before going to medical school and then doing a residency in neurosurgery. He's now a neuro-oncologist at Moffitt Cancer Center, and he is working on breakthrough cancer treatments as well as treating patients themselves with brain and spinal tumors. So I'm going to let Anam tell you his story, and you can watch this video by going to the link that's shown at the bottom of the screen. At the end of the video, you notice that Nam mentioned how grateful he is to the United States for the opportunities that it has provided him, for the encouragement and support that he's gotten along the way in his journey. And this is something that I hear from immigrant healthcare workers and across other domains, that how grateful they are for the openness of the United States, to the opportunities it provides, that they never would have received in their own country. Now, we're going to switch now to talking about immigrants in long-term care, especially immigrants in home health care. We are an aging nation. An American turns 65 every 8 seconds, with 72 million projected by 2050. Another important thing about the senior population is a population that is living longer, often well into their 90s, but then they often have multiple medical needs which require very complex care. So people are living longer, but they have more complex medical care needed. There's also a very important shift in ethnical and racial diversity that's happening with the senior population. By 2050, it is projected that the white population of the senior population now will decline from 80 to 58%, while the Hispanic share of that senior population will rise from 7 to 20%. The Asian population will rise from 4 to 12%, and the Black population will rise from 9 to 12% of the senior population. Now, not surprisingly, the fastest growing segment in healthcare is home health and personal cares. There's projections for increases as much as 46 to 50% in the decade 2008 to 2018. And also, as we know, there's a substantial gray market in this area. Many Americans employ people under the table to take care of aging parents, handicapped family members, etc. Anyone who needs care in order to be able to stay in their home. So we don't know how big that gray market is, but it's estimated it's pretty sizable. But from the statistical point of view, 28% of overall in-home care is provided by immigrants. And not, again, surprisingly, that's higher in certain locations. For example, 83% in Miami, 61% in Los Angeles, and 53% in Washington, D.C. Now, this is a mostly female workforce from Central America, the Caribbean, and sometimes Mexico. It is estimated, nobody really knows, but it's estimated that 1 in 5 is undocumented. What is known is that this is a very poorly paid workforce. They do not have access to any kind of training and support systems. They're not considered part of patient care teams. So this is something, because of their rising importance, the rising senior population, that we need to begin paying attention to. And I'd like to introduce you to one of these long-term workers. This is Elizabeth Mandy. Elizabeth was a refugee from the Democratic Republic of the Congo. She left because of a death threat for many, many years. She didn't know if her family was alive, and they didn't know if she was alive. But they were finally reunited here in the United States. In the meantime, Elizabeth had studied English at the Immigrant Learning Center. She became a certified nursing assistant, and she now works with patients with Alzheimer's. And I'm going to let Elizabeth tell you her story directly, and you can get to this video through the link below. Again, you'll notice that Elizabeth, like Nam, expresses great gratitude to this country, to the people who helped her during her journey. And as I said, a story I hear from immigrants again and again. As part of developing this report, I talked to a lot of key informants. And one of those was Jerry Rubin, Director of Jewish Vocational Services of Greater Boston. And he said something at the end of the interview that I think is really worth sharing. He said, where would we be without immigrants? He said, immigrants are a crucial paraprofessional workforce in sheer numbers, as well as being language and cultural assets. There are many skill issues to address, especially around English language and use of technology. But investing in developing this workforce really pays off for the state in delivering health services and containing costs. In fact, I think the healthcare system in Boston would collapse without immigrants. So something for us really to think about in terms of workforce development, supporting this paraprofessional workforce, supporting the home care workforce so that they can deliver good care to patients, help contain costs in the delivery of health care. Now I'm going to turn to the last group that we're talking about, and that's immigrants in nursing. And if you look at this graph, you'll see that immigrants are a little over 15% of the nursing workforce, and that it hasn't experienced significant jumps or rises over the last, well, it's showing here the 7 years between 2005 and 2012. Now, there are many reasons for this that we'll see on the next slide, because there's a lot of complexity about recruiting and licensing of nurses. It's a very complex picture, and one of the major problems is that there's no internationally accepted definition of what it means to be a nurse. Someone who might be considered a nurse in the Dominican Republic might only be considered a practical nurse or even a nursing assistant here in the U.S. So there's no uniform definition of what it means to be a nurse. The training systems for nursing are also not compatible, and that's when you do see foreign-born nurses. They're most likely to come out of countries that do, in fact, have a compatible training system like the Philippines, but there's not very many of those. Now, there are many language and cultural issues for immigrant nurses. It is for all immigrants, but I think it's particularly hard for immigrant nurses because they are entering a very different healthcare system probably than they had in their countries. There are very different protocols about how things are done. There are different cultural norms about how healthcare organizations operate. And that's all very hard to navigate, as well as often navigating the language. And yet there is a critical need for diversity in the field, in nursing and across the field. The Sullivan Commission, in fact, said that the lack of diversity in health professions is compounding the national racial and ethnic health disparities. Now, health disparities just means that there are groups of Americans that are sicker than other groups, and they die earlier and younger. And this is a national tragedy that the healthcare field is really trying hard to address, and it's clear that a diverse workforce in healthcare is part of the solution. We've got another sort of big issue with nursing, and that is you've got a lot of retiring nurses. These are the baby boomers, and their retirement was delayed a little bit because of the economic recession, but now they're retiring in droves. And also there's a very limited educational pipeline coming out of the nursing schools, partly because those faculties themselves are aging. So you've got a lot of people retiring, you've got a limited educational pipeline that is driving the demand for more foreign-born nurses. Now, fortunately, there are two organizations that are working on this, the Welcome Back Centers and the Imprint Project. They're working with nurses and other medical professionals, and you'll be hearing more about them in the panel discussion. But let's move on to the next slide. Then I'll just have some few conclusions and recommendations. Well, first, I think it is clear that immigrants play critical roles in both the high-skilled arena of healthcare and in long-term care. They're filling vacancies, and that's typical of immigrants, that they tend not to compete with native-born labor, that they tend to look for niches, they look for places where there's unmet needs. And clearly, as in the case of the foreign-born physicians going into primary care or internal care, they're going into areas of great need. They're willing to practice in underserved areas, often inner cities and rural areas. Very importantly, they bring linguistic and cultural competence. And by this, I don't mean that people have to be cared for by someone of their own ethnic or language group. But when you have a diverse workforce, you build the cultural understanding and competence of your organization. People can understand where things might be difficult because of different cultural beliefs in health, and help each other understand, as well as providing some necessary language or linguistic skills, often around vocabulary. For example, in the Vietnamese language, there are no words to describe women's reproductive anatomy. Immigrants are also making it possible for rising senior population to age in place. Going to be a very important thing in how our society begins to address the aging population. And in about a month, you'll be getting the written report that will be issued by the Institute for Immigration Research at George Mason University. And I encourage you to really take a look at this. It's not very long. And in addition to all the statistics that I've talked about, and there'll be more there are also many more stories that illustrate the ambition, the hard work, the persistence to make it, and the courage and willingness to take risks that is typical of immigrants across the board. So with that, I have a few recommendations, and I know that the panel members have recommendations and thoughts about this too. But I think we certainly need to build greater awareness of immigrants' vital role in healthcare. We need to reduce barriers to licensure, increase investment in support and training programs, especially for home health care workers, but all across paraprofessionals and others. Develop the home care workforce as an integral part of patient care plans, and of course, immigration reform. So with that, I'm going to turn it back over to Denzel, who's going to introduce you to some of the panel discussion, and I thank you very much for your time.